Okay, well, this video is about incompetent cervix. I've had several people to email me asking me to do a video on what an incompetent cervix is and a cerclage, a 17P shot, which is also the progesterone shot. So I'm going to do a series of that. So the first one is incompetent cervix. Um, and I will include cerclage in that because it kind of goes hand in hand. And if you want me to explain cerclage more in depth, more in detail, I can do that. And I'm going to do a second video for the 17P and give you some resources and some videos that you can watch for yourself. Um, so, um, sorry for the glare. I am in the living room. My son is napping, so I couldn't do the video in my office because it's beside his bedroom. Okay, so excuse me. So let me explain to you um, how someone can possibly have an incompetent cervix. Like, what are some of the causes of an incompetent cervix? And if you have had a previous surgery on your cervix, there might be some scar tissue or some scar damage that may be done, which could lead to an incompetent cervix. Also, if you've had a damage done during a difficult birth, maybe your first birth didn't go so well and there was like a medical emergency, and that could have done severe damage on your cervix, which can affect your next pregnancy. Um, some women have birth defects or malformed cervix and uterus, and that's something that's out of your control. It's just something that's a birth defect that you're born with, and most of the time, if you're born with it, you would know. Um, and like I said, that's most of the time, not always the case. Also, if you've had a previous trauma from procedures like a DNC, that is from an abortion or miscarriage. So if you've terminated a pregnancy, you might have had some complications from that, or if you've had a miscarriage and you had some complications from that. That can also lead to an incompetent cervix and a DES exposure. Now, I'm not quite sure what that is, but it's some kind of chemical. Um, and I would guess you would get that from your job or um, anything like that. So, um, yeah, you. Those are some causes for incompetent cervix. Now, let me just tell you that an incompetent cervix will not be diagnosed in your first pregnancy. That is not something that they routinely test. So if you go to your uh, if it's your first pregnancy, you go to the doctor and they're doing your blood work. That is not a test that they will perform, and they won't perform that test even if you would ask for it because it's something that they only really diagnose in you after you have either miscarried um, or went into labor extremely early with your first child. And with me, that's how I found out. My doctor, because mine was in preterm labor, they could not stop my contractions. They came to the conclusion that I did in fact have incompetent cervix because I was 2 centimeters dilated when I went to the hospital. Um, so my cervix just completely open, feeling that it was time to give birth. And also, um, my doctor told me that it is usually if you've had 3 or more births that end tragically or you have the babies early. So, but that's textbook terms. But so yes, that's how I was diagnosed. So if it's your first pregnancy and everything is fine, don't worry about it. But some signs that you should look for is if you start having contractions that will not stop. And I mean, I'm not talking about Braxton Hicks. I'm talking about labor, and you're in the first or second trimester of your pregnancy. That is not good. Also, if you are dilated, And the way they find it out is by doing a pelvic exam or ultrasound. If you are dilated 1 centimeter, they will do, there's some preventative methods they can do. Now, incompetent cervix happens in 1 to 2 pregnancies, 1 to 2% of pregnancies. So it's not a very large amount. And about 25% of miscarriages are due to an incompetent cervix. And again, there is nothing you can do about it. If you have an incompetent cervix, you have an incompetent cervix. There's ways to carry a baby full term, but it's not something that you have done necessarily to reach for this to happen. One of the most important treatment and the number one treatment that they will do is a cerclage. I have a McDonald cerclage. I got it inserted at 14 weeks, and they usually do it around 14 to 16 weeks of pregnancy, and they remove it between 36 and 38 weeks of pregnancy. They will take out mine at 36 weeks. So yes, I have a McDonald cerclage. Um, and also, if this is your first pregnancy and you do go into labor early, and you're only 1 centimeter dilated, or you just haven't contracted, showing certain warning signs, they can insert an emergency cerclage. Now, the further along you are, the riskier this is. There is always a chance that they can rupture your membranes, which would lead you to have to deliver the baby within 24 hours. Um, and also, if your cervix has dilated 4 centimeters, or your membranes have ruptured, you are not a candidate for a cervical cerclage. You have to deliver your baby if that is the case, or face being put on bed rest. Also, once you have received a cerclage, after the surgery, depending on your doctor, you might have to be on bed rest for about 1 to 2 weeks. Me, I felt fine after I had mine, but I did stay with doctor's orders and stay in the bed. I have not had any complications with my cerclage. I feel just fine. I do normal activity, but I cannot exercise and cannot have sex. For the entire duration of my pregnancy, I have not had sex and cannot have sex until after the baby is born. Doctor's orders. Now, your doctor might tell you something different, but I would advise against it. Um, and just follow your doctor's orders. So that has been my video on incompetent cervix. If there's anything else that you would like to know, please let me know. Like I said, I've had no problems with mine. I'm currently 7 months pregnant, and this is with my son. I had him at 24 weeks, and I'm 29 weeks today. Today I'm 29 weeks. Wow. So I encourage you, if you have had a history of um, miscarriages or preterm births, then this is something that you want to look into, and it's very important that do the research for yourself to find out if this is a good option for you, if this is something that you feel like you can handle. Because there was the option for me to have a second child and to have him um, at term instead of at preterm. So I hope this video has helped someone and answered the questions for my ladies who have been requesting this. Thank you.